Hello, everyone, and thank you for joining us today. We're the Scleroderma Foundation, and you've joined the Virtual University Patient Education Fall Series. Today's event is titled Making Decisions When It Matters Most, Conversations about Healthcare Proxy, 5 Wishes, and more. My name is Angel Soto. I'm the Program and Services Associate for the Scleroderma Foundation's National Office and one of many facilitators here today. Before we get started, I wanted to share a couple quick notes for today's event. If you're logged in properly, you should be seeing the slides on your screen and hearing my voice. If you've dialed in to the event via phone, please make sure to turn your computer microphone down as to avoid any sound feedback. If you're using a handheld device, you may be required to swipe left or right on your screen to be able to see the full presentation. Today's webinar is being recorded and will be made available after the broadcast. And we also encourage all of our attendees to use the question and chat feature on the right side of your screen, because we will be hosting a Q&A segment at the end of the presentation. So let's get started. I'm happy to introduce today's speaker, Mary Crowe. Mary Crowe is the Director of Professional and Community Education at Care Dimensions, formerly known as Hospice of North Shore and Greater Boston. Mary holds a master's degree in social work from the Boston College Graduate School of Social Work and postgraduate certificates in gerontology and alcohol counseling. She also has a facilitator certification, virtual dementia tour, and dementia live certified facilitator. She's a care dementia specialist, as well as being an end-of-life nursing education consortium core trainer. Over the last 14 years, Mary has led the organization's professional and community educational outreach, and she's coordinated and delivered hundreds of programs each year for healthcare professionals, families, and communities. Mary has worked as a medical social worker for over 25 years in acute care, rehabilitation, skilled nursing, and adult day healthcare settings for individuals, families with advanced illness or at the end of life. She is also an adjunct professor at North Shore Community College and a visiting professor at Salem State University. Welcome, and thank you for joining us today, Mary Crowe.
Thank you very much, Angel. I want to thank you all over there at the Scleroderma Foundation. It's an honor to be with you again today. And we're certainly talking about a very important topic about making decisions when it matters most. We're going to talk about advanced directives. I'm going to talk about the importance of having the conversation. And I'm going to talk to you about ways of even putting your personal directives down through tools such as 5 wishes, honoring choices. And then I also want to talk about the MOLST form with people. And I know we may have people from various states here. MOLST has to do with Massachusetts, but it's called POLST in other places. So I'm going to talk about that with you as well. Like I said, this is just such an important topic. And despite the fact that everybody 18 and over should have an advanced directive in place, the numbers are low. Generally, it's been around 25 to 30% of the population who has completed one. Number may be a little bit higher now, but it's still not high enough. So we'll go into all of that today. So I'm going to start by defining an advanced directive for people. Now, the definition of advanced directive is a legal document that you put in place in advance of who you want making your healthcare decisions for you when the day comes that you are not able to do it for yourself. Now, I always like to tweak that a bit. So the only part I want to tweak is it is a legal document. You are putting this in place in advance. The part that I always like to tweak is that that you're indicating who you want making your healthcare decisions for you. No, I like to say that it's actually who you want being your voice when the day comes that you can't speak for yourself. So it's really a very important distinction. It's so important, and I'm going to say this so many times during this presentation about pick your healthcare proxy wisely. It's a very important thing, and so I'm going to go through the healthcare proxy with you. We could spend hours just on discussing that piece alone. But advanced directives, they actually come in 3 different categories, and an advanced directive can fall under 3 different subsets. So it's a healthcare proxy, durable power of attorney, and a living will. And I'm going to kind of break those down, and I'm going to go into detail on each one of these. Now, you know, healthcare proxies, they vary state to state, by the way. So again, I know that people are on not just from Massachusetts here. So I want to make sure that people understand that, you know, it's called the Massachusetts healthcare form, healthcare proxy form here, but it may be called something in your state. So you want to check that out and make sure that you have the appropriate one when you're completing this. You know, I often ask people, so, you know, why is it that just such a small number of people have filled out a healthcare proxy? People 18 and over should all have one. See, we make an assumption that this is for people who are older or who have a serious or advanced illness. The truth of the matter is, when we turn 18, we become legal adults. And despite the fact that we might have family, whether it be a spouse or children or whatever, they are not legally able to make decisions for us if we are not able to do that for ourselves without having one of these documents in place. So it is so important. So when you're filling this out, like I said, state to state, if you're, let's say that I live in Massachusetts, I am a legal resident here, I can actually, if I live in another state, let's say I also go to Florida for several months, that I might have residency there, you want to have one in both states. If I live in Massachusetts and I go and visit Florida for a couple weeks, there's no need to complete that in other states. But you want to make sure that the state one that you're using is the one where you reside. So these, you know, when I do ask people, what prevents you from doing this? A lot of times people say, well, I can't afford it. Now, there's no cost to a healthcare proxy. They're a legal document. They're no cost. And certainly they don't even have to be notarized. These are legal documents. So that is one thing that, again, people think that that's one of the setbacks. It doesn't cost a cent. So that shouldn't be something. I think some of the other reasons are, this is a topic that people generally don't want to talk about, right? So we put it off. And I always say the things that we need to talk about the most are the ones we've run the furthest from. So, but this is a topic that we really have to get into. Now, people, and also I think when people are young and they're healthy and they don't think of these things. I've actually had my health care in place since I was 25, and I've been in healthcare since I was 22 years old. It's not that I thought I was going anywhere or that something was going to happen necessarily. It's that I knew the importance of this and I wanted to take charge of my health care. I think that's another component for people, is that they feel that if I fill out a healthcare proxy, that I'm actually giving control to somebody else who is then going to make decisions for me. That also is a real misconception. I believe that when we're filling out a healthcare proxy, we're actually taking control. It's such a wonderful feeling to do this. Most times, the times that people do these sort of things or have these types of discussions are in the ICU or the emergency room. Those aren't the times to be having these emotional conversations. So this is a chance to get these things done in advance and they're not weighing on us. So, you know, and then we can go on and live our lives and do the things that are important and have these in place and have peace of mind. The other part of that, in terms of the control piece, is what I like people to understand is the moment that you sign a healthcare proxy, you're not giving control over to somebody else. You actually, the healthcare proxy does not go into effect until your healthcare is determined. Your primary care physician determines that you lack capacity. So they need to actually activate it and say in an order form, the individual lacks capacity, therefore the healthcare proxy has been activated. So the form is not activated from the minute that you sign it. It's not until it's been determined that you lack capacity. You're going to hear me use this term capacity today a lot. And capacity, again, is determined by medical personnel, medical professionals, physicians, and the competency is actually determined by a court of law. So there's the two different things. So what they're doing is when they're determining, do you have capacity? Do you understand your disease process, the ramifications, the benefits, the burdens, and some of those things. And they're able to determine, again, if you're able to make those decisions on your own behalf. But I really think, again, it's important. And like I said, I'm going to go in this and talking about the healthcare proxy more. You want to make sure that that person is going to follow your wishes. And I'll keep explaining that as we go. So I actually feel that people have an ethical responsibility into when you're named as somebody's healthcare agent to follow through on their wishes. It's not always the way it goes. That's why it's important that you pick that person very wisely. You know, there's this survey. I think it's so important. You can see almost everybody feels that it's important to put their wishes in writing, but only 37% say they actually have done so. And that's a little bit better number than it has been. It's been around 25 to 30%. That number doesn't come near what it should be, but it's important. It's always funny when I hear people say they think this should be in place, but yet they're not following through on it. And I think it's because of some of the reasons that I had just discussed. So I talked about these three categories: healthcare proxy, durable power of attorney, and living will. And let's break those down now. Now, this is a Massachusetts healthcare proxy, like I said, state to state. So please make sure that you get a proper copy of the one that is in the state where you reside. But in terms of the healthcare proxy here, what happens is that, as you can see up the top, that there's an area that for people to fill out the demographic information. So your name, where you live. You also, now you're going to choose who you want as your healthcare agent. And you're going to put that person in here in that section where it says appoint as my healthcare agent. It is so important to put somebody as an alternate. I have seen many times where people only put a primary and not an alternate. And I've seen situations where the person who appointed that agent, whoever was appointed as their primary agent, actually predeceased the person who appointed them. Or even if somebody was unable to, maybe they became sick, or maybe they were out of the area and couldn't be reached, that's also an issue. So if you just have a primary person and that person is not able to perform that function, you have nobody as a backup. If you don't have a proxy, a healthcare proxy, and you are unable to make your own decisions, it goes to guardian. It doesn't just bump to the next of kin, like your spouse or your children or what have you. Generally, they don't have legal right to make those decisions if you don't have one of these documents in place. So in this situation, basically what happens with people is that they have to pursue guardianship. And guardianship can be costly and time consuming, and it's not necessarily that the person that you would want in that role. Now, I had a situation years ago. I was working in a skilled nursing facility years ago, and I had a patient come in, and she had advanced Alzheimer's disease. And the person was clearly unable to make any decisions on her own behalf. So I asked the family if they had a healthcare proxy, and they pulled one out and gave it to me. And what I noticed on it was that there was no date. And I said, well, this is not dated. It's null and void. And they said, oh, that was done a few years ago. Just throw a date in there. And I said, well, I can't do that. This is a legal document. I can't put a date in there, and neither could they, by the way. This is a legal document that has to be filled out and understood by the person. So their mother now is not capable of even understanding this form. So we couldn't just throw a date in there. So the form was null and void. And they were not, you know, and I didn't even know, they could have been out in the hallway filling this out, right? So we don't really know the legitimacy of the form. So that form could not be accepted. This family actually had to pursue guardianship. So that's just an example of, again, you want to make sure the form is filled out correctly. So after you appoint your agent, and when you're putting who you want as an alternate, and then you need to sign it. Now, you're signing this in front of two witnesses, not the people who you're appointing as the agent and the alternate. You're basically just getting two objective people, and they're not they're not witnessing that they agree with who you chose to be the agent and the alternate. All they're witnessing is that you understand the form that you're signing. So, like I said, these people should not be the agent and alternate who witness this form, just two objective people. And then again, you'll see down here under the witness statement, there's an area for the date. Please make sure that that is dated. And like I said, it doesn't have to be notarized. On the back of the Massachusetts form, you can see that there is a section that the healthcare agent and the alternate can sign. They don't have to do that. You know, people often think that, geez, I have to have an agent who lives near me. Well, nowadays, listen, people are so reachable that we don't have to have who you choose doesn't have to be somebody that resides in the same state or town or area. As long as the person is reachable, and most people are. Now, if a person is traveling abroad and or they're in the military and they can't be reached most of the time, that sort of thing, that's not a good choice of a person. But it doesn't have to be somebody right here in that area. So let's talk about this in terms of who do you do, and I'll talk to you about what to do with the form after we complete it, but let me just talk to you about how do you choose your healthcare proxy? How do you choose your healthcare agent? Now, I always say, choose your healthcare agent with your head and not your heart. You know, it's important because a lot of times the person that people choose are the person that's closest to them. Now, I have a nurse friend who decided that, and she's been in the field forever, and it took her forever to fill this form out, which is interesting. Even though she knows the importance of it, it's interesting to watch that how people kind of resist kind of doing these and getting them in place. But anyhow, she finally got to doing this, and she knew exactly what she wanted and what she didn't want. She had worked in healthcare for a number of years, and she knew and felt like she did not want to have invasive or heroic measures. She knew exactly. So she went and she had made her husband as her healthcare agent. So she went and said to him, I'm putting you as my healthcare proxy, my healthcare agent, and this is what I want. And what he said was, oh, I can't do that. No, I'm going to do everything. And so it was so important that they had this conversation, and they should be having even more of a conversation around her wishes, because if he doesn't feel like he can fulfill that role, he's not the person to put as an agent. So she actually did not put him in that role, not in a punitive way, but actually it's more of a loving thing in my eyes, because again, you don't want somebody serving the role if they really don't feel capable of doing that. And sometimes, so you have to, as equally important as putting this form in place, it's having the conversation. Now, we think sometimes that because we know people so well, that we, oh, they know what I want. Well, we don't know what we want. Right? That person doesn't know what we want unless you have those conversations. So it's really important. This is a process that you sit down and you really discuss with that person or people or whoever it is. Certainly your agent and your alternate, but certainly those who you love around you. It's important that they understand what your wishes are and what you want. And the question to be asked, is this something that you feel comfortable with? I really want to make sure that my wishes are honored. Is this something that you feel like you can do? And if it's not, that's okay. I'll get somebody else, but I want to make sure that this is what I want and that that's what's going to happen. I think it's important to have these conversations. I'm going to tell you, it's interesting when you have people run from these conversations, but people want to have them. And what we have found was that these conversations, again, that are so hard, it often takes pressure off of people. It does. It actually even helps, with some, conflict within families too. I had a situation where and we'll talk about this when I do the 5 wishes, but the mother had actually talked to the daughter who she made her healthcare agent about what her wishes were, and the daughter was fulfilling that, and the son came in and he was very upset and said, no, we have to do everything, and the mother didn't want that. And so the daughter said, no, mom said this is what she wants, and the son said, well, she never said that to me. And fortunately, the mother had actually completed a 5 wishes form, which I'll go over in a little while. And it was in her own handwriting and everything. And the daughter pulled this out and said, this is what mom's expressed wishes were. and it was very helpful. And the son really, again, felt better about it in terms of understanding that this was what her wishes were. This is even in her own handwriting. So again, you can see that, this is a hard time when people are in crisis around medical situations like this, or advanced illness, end of life situations. It can really, it can bring up and you can have some conflict in these ways. It can also bring people closer together too, but you can certainly see sometimes that there's a lot of emotion here, and people react very differently to these situations. I always say, you can grow up in the same household and have a different childhood, right? I love this saying, and it's, it's so true. People respond differently just based on their own personal experience or their own coping skills, support systems, all of those things, how they react. So very important, pick the person wisely, have a conversation with them. When you complete this form, what you want to do is you keep the original. You make several copies. You give a copy to your primary care physician to have them put in the medical record. You give a copy to your healthcare agent. You give a copy to your alternate and anyone else around you that you want to have a copy. When you make several extra copies, you want to keep that original, keep it in a fire safe box in your home. Don't put it in a safety deposit box in a bank. A lot of times people do that and they don't have access to that 24/7. So you keep that original safe, but where it's very accessible. So you have copies. So even if you've given a copy over, anytime that you go in to a healthcare facility, even let's say you're having a minor procedure done, you should always bring a copy of your healthcare proxy. Now, people will say, well, I've already given them one. You just can't depend on that. And again, if they have it in there, that's great. Now there's electronic medical records, but the thing about that is not everybody uses electronic medical records. And the other piece to that is that there are different healthcare systems and they're not all interlocked. So sometimes you have to make sure that they don't always have access to that. So I always make sure I bring a copy. Now there's the Patient Self-Determination Act of 1990. And what the Patient Self-Determination Act said was that any facility, healthcare facility, which accepts Medicare and Medicaid, federal and state programs, so any healthcare facility that accepts this is mandated to ask you about a healthcare proxy. So that's why you'll see when you go in, they always ask that question. Now, but what I hesitate is sometimes instead of asking you, do you have one, they might just hand you another one. And I always warn people, that's why I like people to have a copy too, because sometimes people are filling out several of these and they have different ones everywhere. Now, I always like to keep it clean and have, my one healthcare proxy, and then the same one that I've dispersed to the people that I had mentioned to you. And then if for some reason it needs to be changed, you want to make sure that you fill out the new one and that you exchange that and get rid of the old ones. Now, let's say you do have several copies of this around. What happens is that the one with the most recent date is the one that is valid. All right. So you just want to make sure that, again, every time you're going in, you're just not refilling this, and that some people have the old version and all of that. Now, I've also been asked, do you have to update these? Well, it's a good idea too, because people have changes in their life. I was working with a community group and they said, I had a gentleman say, I did mine 15 years ago. Do I need to update it? And I said, well, technically no. I said, but have you had any changes in the past 15 years? And he said, nope. And I said, really? In 15 years of your life, you've had no changes? He said, nope. I said, really? Wow, that's amazing. I mean, because if you think about the past 15 years, usually people have had significant changes. So what he said was, so I said, so who you have appointed as your agent and your alternate, they're the same, and where they live and their phone numbers and addresses are all the same? Oh, no, they've moved. So phone numbers and addresses had changed on it. Now remember, this is a legal form. So we don't just scribble out and change things on this form. and you don't white out or anything like that. Like I said, this is a legal thing. So what I would do is if there are changes like that, you want to update it. Sometimes there are even changes for people, like who you had appointed now, it might not be who you might have even 5 years from now. So it is good to update this. Now, so you can have these. And again, there's no cost to this. You can get these from any healthcare organization in your state, and they'll be able to give you a copy of your state's form. Now, the other thing with this too is, again, some people even put these, by the way, on their vial of life, or their file of life, excuse me, that they have on their refrigerator, right? Or on a copy of it. You can put it on your refrigerator, or it's on the back of your door in your home, because that's where emergency medical personnel will look for this too. So it's always good to have a copy there if you have that. They're not going to go looking through folders and such. So that's what we do with the healthcare proxy form. And remember, like again, always keep that initial form, the original. Now, I was going to say too, you can fill these out. Some people will go to an attorney, and I'm going to talk about that in a minute, because I'm going to talk about the durable power of attorney. Sometimes if you go to an attorney for other things too, and people are doing some documents, they might do that through an attorney. That's okay too. But I just like people to know you don't have to go to an attorney to do the healthcare proxy form. The cost should not be a prohibitive factor. All right. Now, I want to talk to you about, I just want to touch on this, okay? Because, the healthcare proxy, like I said, doesn't cost a cent, don't need an attorney, all of that does not go into effect from the minute that you sign it. So when I would have families coming in and they'd say, oh, my mother's healthcare proxy, I'm the one that gives and gets information, and the person's parent or whoever it was actually had capacity and was making their own decisions. So that's not true. They can't be given that information just because they're on the form. If the form isn't activated, again, they don't have the right to get that kind of information, right? There's Privacy Acts with HIPAA and all, unless the parent or whoever it was gives permission for us to give information to that other person. Now, a durable power of attorney. As I said, you could do the healthcare proxy without an attorney. I would never do a durable power of attorney without use of an attorney. And also, when you choose an attorney, make sure that they're well-versed in elder care or estate planning. Sometimes people will use attorneys that are, real estate or other types of attorneys. That's not what you want in terms of this. These are really specialized areas, and there's changes in these all the time. And these types of attorneys just keep up on all of this. So that's how you would go. Now, durable powers of attorney, they generally encompass finances. There are some durable powers of attorney that do address medical stuff as well. And again, you're going to see this different in terms of state to state, and also even again, depending on the type of power of attorney that you're doing. You want to make sure you sit and talk carefully, because some powers of attorney, again, when we're talking about the financial piece and all of that, from the moment you sign it, they can go into effect. So that person who you're appointing in that regard could have access to your finances. So this is why you sit down with an attorney and you talk about what is right for you. So that does not happen with the healthcare proxy. That can happen depending on the durable power of attorney that you're filling out. So I'm not going to say much about this, but all I want to say is that you can get any kind of document offline these days, but please, if you're doing a durable power of attorney, please make sure you go through an attorney with it, and that they're, like I said, elder law or estate planning attorney. Now, living will. Living wills, they're different, right? It's not a will. A will is something that you do with an attorney, you set up, that disperses your stuff after you have died. That's what a will is. It has to do with those possessions and things like that. A living will has to do, it really spells out the type of medical treatment or measures that you want, such as being on a ventilator or things like that, tube feedings, resuscitation, all of that. Now, a living will is a great thing. It provides guidance. Now, what I like people to understand is check your state, because for instance, in Massachusetts, a living will is not a legal document. So living wills are legal documents only in a handful of states. So you want to check to see if the state that you live in, that it is a legal document. Now, it doesn't mean that living wills aren't good. They are good. They are very helpful. They provide really a guide to what a person's wishes are, and you can really get very specific and spell things out. But if it's not legal in your state, you're not using it in that way, and it necessarily wouldn't hold up in court. But it's a guideline for people too. And I know that, healthcare providers will certainly pay attention and look at that in terms of understanding more about that, what that person's wishes are. But you do need to understand that in certain states, these are not legal documents. But again, still an important guideline. So I actually like when people fill out these types of forms. When you get these forms done, again, make sure the person you're appointing as your agent, the alternate, and this certainly applies to that healthcare proxy and all, make sure that they know and they have these. I've had situations where the person lacked capacity. Now we had to call the person they appointed as an agent. And when we got the person on the phone, we started asking this question about the person's care, and they said, well, why are you calling me? And when we said, well, because you actually have been listed as the person's healthcare agent, and they said, I didn't even know that. So not only is, sometimes we don't even fill these out, or we don't have these conversations. Sometimes a person just puts somebody's name in and doesn't even check to see if they can fulfill that role, or that they're willing to. So very important that you have these open discussions with people. So make sure that the person you appoint, that alternate, the physician, healthcare providers, anytime you're getting care and family members, that they have this. Any other person that you want to have a copy of this. I always keep several copies. Some people, I'll have them keep a copy in their wallet, or sometimes people even keep it in their glove compartment. So just a copy of it. So, I want to just talk about the conversation for a few minutes, because like I said, this is as equally important. And, we can really see, even though this is something that people kind of run from, when they've done surveys on this, that 92% of people say that talking with a loved one about end of life is important. So they really feel like this is something that is important. But as you see the numbers, only a small amount have done so. And I think one of the things that they worry about is that by having these conversations, it's going to be upsetting to people. I think that, sometimes people are tiptoeing around each other in terms of, they want to have the conversation, but each party might feel like, oh, I don't want to upset them by doing this, or, these are, I think it's more upsetting for people not to have these conversations. Like I said earlier, I warn you, let's not have these conversations during crisis time. That's the time when people are most upset. If we have these conversations outside of that time, and they're done well in advance, we don't have to do this with all of that emotion also built up. So I think it's really important around the timing of this. So, 53% said they'd be relieved if a loved one started the conversation, and 95% said they're willing or wanting to talk about their end of life wishes. So we can see from these numbers, people do want to talk about it, but again, people shy away from it. So when you're trying to start these conversations, I always look for the teachable moments. I'm going to list these out for you. Oops, let me just go back, excuse me. These teachable moments. So for instance, I used to, my grandmother and I used to sit, and she used to love the show St. Elsewhere. So she and I would be sitting there, and I can remember her, there would be these different scenarios that came up on the show, this medical show. And I would say to her, geez, in that situation, what would you want? This is what I would want. So you could see I wasn't even focused on, geez, you're older and let's talk about you. This is about all of us. By the way, I just want you to know how healthcare proxies actually came into effect were because of landmark cases. And these names are probably familiar to you. Karen Ann Quinlan, Terry Chavo, Nancy Krazan. All of those women were actually in their 20s. So these were landmark cases that actually pushed for these types of advanced directives to be initiated, by the way. So, although we reserve this and think this is just for people who are older and ill, not the case at all. So, it's really important that, so even like if there's somebody has an illness and you can say, or even that there's been a death in a family or a friend's family or another relative or what have you, these are teachable moments, and we can say, geez, look at, this is what so-and-so did, but what would you want? I also think a massive teachable moment is the pandemic right now. This is, I got to tell you, more than ever, this is such an important topic. We teach this. I go around and I talk about this all the time. This is, the pandemic has actually put more urgency to this, and certainly because there is uncertainty. And again, certainly there are people in higher risk groups who are up in age, over 65, and certainly if they have other comorbidities or other health issues, they can be put in higher risk groups. But as we have seen with the pandemic, it can affect everybody and even children. So these are things that we want to make sure, and I think that the pandemic has really stimulated some people to have these conversations, which they weren't going to do before. So this is actually a major teachable moment when right now, okay, given the fact that there's uncertainty, we don't know still a lot about this. We know more than we did certainly when it started, but certainly there's still a lot of fear and uncertainty around this. This certainly, again, I think has motivated people to get in touch with their primary care team and to have these discussions. And I know, listen, it's hard because you can't go in and have conversations necessarily all the time because every healthcare system now is doing things a bit differently. But I will say, as of January 1st, 2016, actually, they had passed a law saying that you can actually make an appointment with your physician and go in and have an advanced care planning or goals of care conversation, which is what these are. And that's actually covered under insurance. It's paid for. You can actually make these and go in. So this was a really wonderful thing. So, this was passed under Medicare and all, that people could do this. So it's very important. Now, people can also make these types of appointments virtually as well. So you don't have to go into the office to have these discussions. You can get in touch and say, I want to speak to my primary care provider, my healthcare provider, and I want to be able to make an appointment and to have this type of discussion, even virtually, either by phone, or you could do it in a more virtual, like via Zoom or something like that. So these things are still very possible to do, and it's very important time. So, the right place, the right time, being able to have the, comfortable language about this. Also, I have had people say, geez, I tried to talk with my kids about this, and they say, oh, I don't want to hear it. Don't talk about that. It's really important when people say, look, I'm not bringing this up because I think somebody, that I'm going somewhere, but I'm bringing this up because these are important conversations, and this is going to bring me peace of mind. And I hope that it will you as well. We should all be talking about this. So it's important that we understand everyone should be talking about it, just not specific people. Don't do it when you have like a few minutes. That you got to really have time for this, and you're not going to do this in one sitting. You really need more time on that. So it's important to make the time to have these conversations and make sure you understand the person. Really reiterate back to them, this is what I'm hearing you say, is this what you want? And make sure, and you can talk about related matters too, even, funeral arrangements, other things that come up as a result of this. If I just want to go over 5 wishes and honoring choices for a minute, and then I'm just going to touch on MOLST, and then I'm going to open it up to questions. 5 wishes is a form of a living will, and it's really a wonderful tool. We use that a lot in our work here at Care Dimensions with our patients and with the families. So, this is a type of a living will, and this actually went into place. This was actually done quite a while ago, and Jim Toohey, who actually started this, he worked with Mother Teresa in Calcutta and then worked with her in her AIDS home in Washington. And what they found was that people's wishes were being met from a physical standpoint, but from an emotional and a spiritual point of view, things weren't being tended to. So they started doing, this is the first living will of its kind that tends to spirit, mind, and body. So what they did was they opened it up in Florida to see as a pilot program, see how it worked. It went over so well that the next year, through the support of the American Bar Association, they opened it up, and now this is around the world, and it's in many, many different languages. So, you know, these are, and you can get these through Aging with Dignity. They do cost something. We also can, I can get copies of these to the Scleroderma Foundation, and you can get them from them. So the, you know, they're just wonderful, wonderful resources. Now these, and you'll see in it, 42 out of the 50 states actually recognize this document. Massachusetts is one of those that recognize it. Now I'm telling you this is a living will, but Massachusetts recognizes it only because Wish 1 is a form of a healthcare proxy, but Wish 2 through 5 are really part of that living will, and those are not recognized, again, legally. So with the, just going over quickly with this, you know, they're broken up into 5 different sections, and Wish 1 talks about healthcare. It's about a healthcare agent, and it will guide you right through how to fill this out. There are bullet points, and there's check-off boxes, and even narratives. If you want something to apply to you, you'll circle it. If you don't, you'll put an X through it. So each section is different. Wish 2 is about medical treatment that you want, talks about life support, do not resuscitate in different scenarios. Also, Wish 3 talks about pain and comfort, talks about hospice, palliative care, things like that. Again, there's bullet points on this one. Circle the ones you want, put an X through the ones that you don't. Wish 4 talks about how you want to be treated. You know, who do you want around you? You know, what types of rituals, music, pictures, other things. And again, you'll fill out those sections. You'll see they have different things coming up in terms of bullets or check boxes or such. And then the Wish 5 is about spiritual needs. You know, relationships are complicated, aren't they? And basically, this talks about you know, what do you want the person to know? Like, are there things that are left unsaid that you want? You know, it even talks about forgiveness and things like that, organ donation, burial wishes and such. So this is it's a really nice form. It talks about, again, so when you complete this form, you keep it. You can't make copies of the 5 wishes and hand them out. You have to use them in their original forms. What I have done is I have my healthcare proxy, and I just attached it, and I filled out Wish 2 through 5 because I had done my healthcare proxy through an attorney because I was doing other documents at the time. But again, this is it's a wonderful tool. But you'll see on that, and you'll look to see how the states recognize it. Honoring choices is another type of a living will. Wonderful, and it's just another option for people. So for people to pick which one resonates with them, both of them are wonderful types of forms, and there are other ones out there too. These are the 2 main ones that we use. And Honoring Choices has a Getting Started toolkit, and they also have a Next Steps toolkit. Now you can, again, I can get you know, certainly here in Massachusetts, I can get packets over to them here at the Scleroderma Foundation, and we can certainly have these things sent. Remembering again that these are Massachusetts forms too, but look in your area for things that are applied that are statewide for you. I just want to touch just for a minute on the MOLST form, and like I said, then I'm going to just go right over to questions with you. The MOLST form, again, it's a POLST form nationally, and that's Physician Order for Life-Sustaining Treatment. In Massachusetts, we call it a MOLST form, Massachusetts or Medical Order for Life-Sustaining Treatment. This is not an advance directive. So I just got done saying in one category, advance directive, legal documents, healthcare proxy, durable power, living will, even though living wills are not legal documents in so many states, right? But it still falls under the guise of an advance directive. In this, a MOLST form or a POLST form is actually an actionable medical order form. So this is intended, and I have sample always plastered on mine because I'll have people say, oh, can I have a copy? No, the way this is intended, and this was supposed to be up and running totally by 2014, even though sometimes people still have some confusion around this. You sit down, you go in, you sit down with your physician, physician assistant, and nurse practitioner, and you complete it with them. So you shouldn't be taking this home and doing it. You're to sit down, or you can do it virtually now. And by the way, the MOLST form, in Massachusetts, I can say this, but a MOLST form, because this is the Massachusetts version, for the duration of the COVID-19 state of emergency, the state has suspended the standard requirements of a written signature on the MOLST. So you can do this with verbal consent, which is really a wonderful thing. But you sit down, or you talk with your physician, physician assistant, nurse practitioner about cardiopulmonary resuscitation, ventilation, transfer to hospital. You sign it, your physician signs it. Then you do the backside, which is almost like a separate form around intubation, ventilation, artificial nutrition, hydration. You sign it, and your physician, physician assistant, nurse practitioner signs it. You keep the original of this. They're generally on bright pink forms so that they're easily to see, and you put a copy in the medical record. You keep the original. These forms go across all settings, all healthcare settings. So these are really neat. I love this form. It talks about what you want or what you don't want. Not everybody is intended to have this. So I have some physicians that say, I do it with all of my people. I do it with all my patients. Well, it's really not intended that way. This is really, if you're appropriate to have a discussion with your physician around a do not resuscitate, you're appropriate to have a MOLST or a PULSE form. It's really for people who have, that they're having some kind of a serious or advanced illness or even frailty, that sort of thing. Now, there are some people that say, I want a MOLST form because I know what I want. Even though I'm young and healthy, I want a MOLST form. It's fine. You can fill that out and you can talk to your physician about that. This is a nice form. So I just want to go back one thing and say to this though. Remember I said pick your healthcare proxy wisely. You can fill this out, and let's say that, geez, I have mine all filled out, and I don't want to be resuscitated. I don't want to go to the hospital, and I have all of this completed. Well, then now I lack capacity, right? Now I'm in a situation with my health status and I lack capacity. My healthcare proxy actually has the ability to change this, because remember, this is a medical order form. So I just like to point that out to people. So again, you want to make sure that the person you're appointing, isn't saying, you know what, nah, I don't agree with you. Nope, I'm going to do everything. So that's not really abiding by my wishes. So you want to make sure that the person you're putting into this position is going to honor your wishes. All right, I'm going to stop there. And I'm going to just give it back over to Angel so that we can, because I'm sure there's questions on this and I want to make sure I allow enough time.
Thank you so much, Mary. That was a wonderful presentation, and you covered so much. And we did have some attendees jump in and ask questions. So we have today with us the Director of Programs and Services, Carrie Connolly, and Director of Chapter Relations, David Murad, and they'll be hosting the Q&A section.
Thank you so much.
Go ahead, David, whenever you're ready. Looks like we're having just a little bit of issues with the microphone, so I'll jump in. Oh, there you go, Carrie.
Yeah. Hi, David may have some technical issues. I'll take the first question that we have coming in. Mary, again, that was a great presentation. The first question I have is, if I'm in the ER or hospitalized with no relative, friend reachable, no proxy, will the medical decision making fall on the doctor treating me?
Yes. And again, they would go based on the hospital protocol and what their emergent policy and procedure is there in the hospital. Yes, that's what they would do. They have to, if you're there in an emergency and there's no decision-making capacity and nobody to reach and all of that, they have to do and follow what their emergency protocol there in the hospital would be.
Okay, great.
And each one is different, right? So it's not one standard for all hospitals. You know, they sit down, they have their own policies, procedures around this, and that's what they would do.
Mary, thank you for going over the 5 wishes. Can you tell, the question that came in, is there a cost related to this document?
Okay, very good question. And so was the previous one, by the way. You know, so there is, you know, again, Aging with Dignity is the website. And I'm gonna click through these for a second, just to get to because they're where I can give you these two, Carrie. Hold on just a second. There's Aging with Dignity, and I can give you with that. So you can go on, you can download it online. It used to be $1, now it's $5. I don't know if they've waived that because of the pandemic, but like I said, you can certainly check. I am happy to share. We get them in large quantities. I can get you a stack of these. And like I said, if you have 6 people in your family, I want you to have 6 of these. I don't want you to, don't make copies, like I said. So there is a cost. I would go on the website. It's wonderful. And you can actually see, but generally, again, there is a cost to download and to have one. It's a nominal cost, but still for some people that's, you know, it's a lot. So we can always get copies out to people.
Excellent. Thank you, Mary, for that generosity. Looks like David is live now. David, did you want to ask the next questions? David? So we're still having some technical issues. Mary, another question that came in, and you did answer this question, but I think it might be good to reinforce it.
Sure.
If I have a healthcare proxy in Massachusetts, but I go to New Hampshire for treatment, will that cover into that state?
Now you should have one in and New Hampshire. You know, it's interesting because we have bordering states here, right? And you think, oh, because we're in Massachusetts and New Hampshire that we do everything alike. Couldn't be farther from the truth. Very different. And they don't even call it a healthcare proxy in New Hampshire. They call it, I believe, they call it a durable power of attorney for healthcare. So no, if you are doing, you want to make sure that you are, you have a form that is applicable to the state.
Okay, great.
Like I said, I would have one in, you want to make sure, I would have one if you are really, wherever you're a resident, but you want to check with the organization. If you're living in New Hampshire and you're having your care in Massachusetts, I would check with your providers here and make sure that, again, that they're going to recognize that document.
Okay.
But if you, you know, you should definitely, if you have residency in a different state, you go ahead and you make sure that you have that form filled out statewide as well.
Great. So I'm going to piggyback on this similar question to this category. If I am in a different state, if I live in Massachusetts and I require care from a different state, can I change different people based on the state?
So you're going to have different proxies set up in different places?
That's how I'm interpreting the question.
Geez, it's a good question. I guess my question would be why? Why would you want to do that? Because again, if you're making a decision on somebody, it shouldn't be based on state. You're making a decision on the person based on, are they going to honor your wishes? And are they going to really do that for you? And are they the person that you want being that voice for you in those situations? Why should it matter in terms of which state? I guess that's what if I'm understanding that question correctly.
So they actually typed in a response to me while you were chatting, and their reasoning was they thought maybe that geographically they needed to have somebody closer to where they were.
And I did, yeah, and I'm gonna, and let me say that, I want to mention that again. I did bring that up, but I gave a ton of information in this program, and I want to reiterate this. you don't have to have somebody locally. You don't. So again, if I am living in Massachusetts, I have the Massachusetts Healthcare Proxy Form. If I decide that one of my people that I want to represent me as my agent or alternate lives across, they could live in California, and it doesn't matter. I'm not going to have a form in California because they would be my healthcare proxy. I'm going to have my Massachusetts healthcare proxy form, and I can pick anybody anywhere to do that. People are reachable. So now, like I said, I wouldn't choose somebody if they're traveling the world and they're not accessible. They're out on a boat in the middle of the Caribbean somewhere, or they're maybe even in the service necessarily where they are not reachable. There's situations where I wouldn't have somebody that was far away if they weren't accessible, but people are so accessible now. You don't have to physically be there to make the decisions. They can reach you by phone, and those decisions could be made with the medical team via phone. So, and generally, if there's a crisis situation, then that person might be getting to that person. But in the meantime, those decisions can all be made over the phone. They don't have to be in person.
Excellent. Actually, the last one is not a question, but a comment, but I think it's very important to let you know. This attendee just wanted to mention to you, Mary, that this was a phenomenal presentation, that they have the first 3 documents in place and still learned so much from the presentation and hearing about the 5 wishes and plans to check that out. And they just wanted to thank you again.
Oh, what a very nice comment. Thank you so much. I really appreciate that kindness and the comment. This is such an important topic, and I really appreciate that person. Thanks for coming on. Despite having all of your documents filled out, I really applaud you that, again, you're taking this so seriously and knowing that these really matter. And I'm glad you got something out of this. So thank you very, very much.
So Angel, that concludes the questions for
Thank
today.
you, Carrie. Yeah, thank you, Carrie, and thank you, Mary. Again, that was a wonderful presentation. We're so very happy to have you. In closing, I would like to thank you for sharing your time and expertise with us today. I would like to thank our attendees that logged in and dialed in today. And I want to give special thanks to our Diamond National sponsors, Actelion Pharmaceuticals US and Boehringer Ingelheim, and our corporate sponsors, Corbus Pharmaceutical and Horizon Pharmaceuticals. Please stay connected with us through our website, scleroderma.org, and social media outlets to stay informed on our virtual university patient education fall series and all our great chapter virtual events happening now across the country. This will conclude today's webinar. Thank you and have a wonderful day.